The opioid epidemic in the state of Maryland is ravaging urban, suburban, and rural communities, with over 2,000 opioid-related deaths reported in 2017.
It's an epidemic on top of endemic.
Overdose death rates have increased by over 400% in the last 20 years.
Fewer than 20% of people who need treatment for opioid use disorders have gotten connected to care.
Most concerning for us has been the lethality of the drugs that are on the street.
The Division of Addiction Research and Treatment stands out as a national leader in the development of models of clinical care, research, and education.
Our focus is on the treatment of opioid use disorders. In addition, we are committed to educating clinicians and students in the community in better understanding addiction disorders. And also, we have a mission for research as well to try to develop better understanding of treatment methods to help our patients.
We're all very involved at the national level in the American Psychiatric Association, the American Academy of Addiction Psychiatry, the American Society of Addiction Medicine. All of us have been very involved with those national organizations, which really do a lot to help set the agenda on how addiction is addressed in the country.
I think that what's more unique is the attitude and the willingness to be innovative, the accessibility and availability of grants, the willingness to pursue and take the effort to explore new programming. That's what truly makes this program unique.
Developing innovative initiatives, the division is redefining and expanding access to treatment.
Right now, the division is probably meeting clients in every context, every medical context, from the outpatient setting, primary care settings, specialty settings, in collaboration with our hematology colleagues, in the inpatient setting with our substance abuse consultation service, in the residential treatment setting through the telemedicine interventions in Western Maryland, and also in the post-acute setting.
So there are certain places, including the criminal justice system, the hospital system, where you have a chance to engage a patient in treatment. If you don't do it at that time and refer them out for treatment, you've lost an opportunity. So our focus is acute engagement and treatment when the opportunity exists.
This division is full of fantastic mentors that have truly opened my eyes to the possibility of treatment within the substance use population. And we're constantly riding the wave of innovation.
We're innovative, we're willing to do things that are different and think outside the box.
Historically, many in the medical community have not recognized addiction as a treatable chronic condition or appreciated the possibility of successful outcomes.
I think the most important thing for physicians to understand is that addiction is, and it behaves very much like any other chronic medical condition. It's a condition that is often blamed on the individual. People do not look at it the same as other chronic medical conditions.
What's most important to me is showing the students here that it is possible to treat opioid use disorder, and it isn't a chronic disease that's full of despair. You can truly bring life and enjoyment back into an individual's life.
The most important teaching moment is to have my residents and medical students see patients that are doing well, hear them tell their story that, yeah, I was out there, my whole life was just about using drugs.
And you have very, very appreciative patients who, whose lives have gotten out of control, and helping them to get things back in control. So I think a lot of it is just the satisfaction of helping people that have traditionally not been helped very well by our medical system.
We get to treat patients and see them get better, and patients with addiction disorders that get better really truly can live a full and meaningful life.
There's a lot of emotion involved. It's an opportunity to bring families back together. We work really hard to try to make it a meaningful moment.
I think my rewards are when we see patients doing well.
The rewards of first and foremost are seeing patients do well, and then kind of along the way, I really enjoy working with my colleagues here and getting more involved in research and writing, as well as teaching.
We all have our strengths and areas of interest, but together we feel like we can really make a difference in patients' lives.